Turning to the United States, 10 people deemed to have been at the highest risk of exposure to an Ebola patient in Dallas are now in isolation. Local officials said on Friday the 10 are from a group of 100 initially feared to have had direct or indirect contact with the Liberian citizen Thomas Eric Duncan, who was the first Ebola patient diagnosed in the United States. Officials say the 10 patients are cooperating with public health authorities. The family that hosted Thomas Eric Duncan have moved out of their quarantined apartment into a new home. They were moved into a private residence in a gated community that was offered by a volunteer. A hazardous materials crew then decontaminated the apartment. CCTV correspondent Jim Spellman has more.
After several days of delay, crews in hazardous material gear arrived to clean and decontaminate an apartment where 4 people are being quarantined under the close watch of armed guards. They all came in close contact with the first U.S. Ebola patient, Thomas Eric Duncan. Despite several missteps in the response to this case, authorities say they are confident the situation is under control.
At this point, the situation is contained. We only have one confirmed case. The real issue at this point right now is to reduce that circle of 100 possible contacts, and so we can be focused on recovery. And I think that's where we're moving.
And in separate incidents, 2 men in the Washington, D.C. area with Ebola-like symptoms are being held in isolation while doctors test them for the deadly virus. Experts say physicians everywhere are learning from the Texas case.
This is a wake-up call. This is a sign that we could have imported cases as long as there is this outbreak happening in West Africa. There are now hundreds or perhaps thousands of people at this very moment who are infected with Ebola. If any one of those people would travel, that person could end up anywhere else in the world, even before the onset of symptoms.
The U.S. military will send 600 troops to Africa, in addition to the 3,000 already committed. These troops will build infrastructure like Ebola treatment centers and provide logistical support.
We're not going to be treating patients. The troops are not equipped to do that. That's not their job. But we are going to be trying to help establish the infrastructure, health facilities, emergency treatment units, that kind of thing, so that the healthcare workers can do their jobs.
The Pentagon says there ultimately could be 4,000 troops sent to West Africa to assist. In the last few days, 2 new labs staffed by U.S. military personnel have opened in Liberia and are currently doing blood work. Pentagon says the first U.S.-built Ebola treatment center will open October 18th. Jim Spellman, CCTV, Washington.
An American cameraman diagnosed with Ebola in Liberia will be flown back to the United States on Monday for treatment at a facility in Omaha, Nebraska. 33-year-old Ashoka Mukpo was diagnosed Thursday with the disease and is being cared for at a treatment center in the Liberian capital, Monrovia. His father said Mukpo is in the early phases with fever and muscle aches. Mukpo is expected to get initial treatment on the plane. His father also said the Nebraska Medical Center is fully prepared to receive his son.